Hi, my name is Emma Allen. My case study is on myocardial infarction, also known as a heart attack. The chief complaint. Our patient presents to the emergency department with complaints of chest pain, pain in his left arm, along with shortness of breath. The pain history is that it started this morning, nothing makes the pain feel better, movement exacerbates it, and the patient has no prior history of myocardial infarction. We're going to get into our patient history. Our patient is Harrison Boyer. He is 67 years old. He's an African American who identifies with the Christian religion, and his diagnosis is a myocardial infarction. His medical history is hypertension and diabetes mellitus. His surgical history is an appendectomy, and his family history is that his father had atherosclerotic cardiovascular disease and his mother had hypertension. His personal and socioeconomic history. He smokes 1 pack of cigarettes a day and has for the last 30 years. He does not use any other drugs. He does not drink. He's allergic to penicillins. He's on a diabetic and low sodium diet. He's a former mailman who's currently retired. He lives at home with his wife, and he gets about 7 hours of sleep every night. Clinical findings. Lab values that would be elevated with the diagnosis of a myocardial infarction are troponin levels. They would be around the 99th percentile or above for a heart attack. Medications that we could give are aspirin, which is an antiplatelet, anti-anginal medications like nitroglycerin, ACE inhibitors like lisinopril, calcium channel blockers, and beta blockers. The pathophysiology of a myocardial infarction, also known as a heart attack, is when the blood flow that is traveling to the heart becomes obstructed or reduced, and this leads to a lack of oxygen getting to the heart, and that causes tissue ischemia, which means that heart tissue is dying. Risk factors for a heart attack are high blood pressure, high cholesterol, diabetes, being over the age of 50, gender, specifically males are more predisposed to having heart attacks, smoking, and race. African Americans and Hispanics are more predisposed to having heart attacks. Clinical features and symptoms. Chest pain and discomfort or heaviness. Some people describe heart attacks as an elephant sitting on their chest. Discomfort in areas of the upper body, such as the neck, jaw, arm, or back. Shortness of breath, lightheadedness, irregular heartbeat. Medical management. PCL, which is a coronary or percutaneous coronary intervention. A CABG, which is a coronary artery bypass graft. And a stent procedure, which are open heart surgeries. Complications that you can have because of a myocardial infarction are cardiac arrest, heart failure, arrhythmias, and it can lead to more heart attacks. We're going to get into our NCLEX questions now. Question 1. A patient was diagnosed with a myocardial infarction. The provider ordered labs to confirm the diagnosis. Which lab level would be indicative of a myocardial infarction? A. Elevated troponin levels. B. Decreased BUN and creatinine. C. Elevated serum potassium, or D. A decrease in white blood cells. The correct answer would be A. After a heart attack, generally 1 to 2 hours after, the troponin levels will have increased past the normal range, generally to the 99th percentile. Question 2. Which of the patients listed below is most at risk for a myocardial infarction? A. A 19-year-old white female with a history of hypothyroidism. B. A 40-year-old Hispanic male who smokes 1 pack of cigarettes a day. C. A 70-year-old African American male with hypertension. Or D. A 60-year-old woman with diabetes mellitus. The correct answer would be C. Although all of these patients, except A, have some risk factors, C has the most risk factors for having a heart attack. Question 3. A patient came to the hospital and was diagnosed with an MI. Which of the following would you expect to see? Select all that apply. A. Chest pain. B. Headache. C. Shortness of breath. D. Right arm pain. Or E. Vomiting. The correct answers would be A, C, and D. These are very common signs and symptoms of a myocardial infarction, whereas a headache is very unusual if you're having a heart attack, and vomiting can be a sign, but it's not a common one. These are my sources. Thank you.